Welcome to the Stroger Hospital Video Training Module number 3, Hand Washing and Hand Hygiene.
Did you know that proper and frequent hand washing is one of the most effective procedures for maintaining good hospital infection control? It's true. Hand washing displays a vital role in the health and overall wellness of patients, guests, staff, and environmental services workers at Stroger Hospital. Scientific research has shown that it is the number one most important infection control mechanism for hospitals. As such, everyone at Stroger Hospital takes hand washing very seriously. As a member of the Stroger Environmental Services team, you need to set the example and make frequent and proper hand washing an important part of your daily work routine. In this training module, we will cover the step-by-step proper procedure for infection control hand washing, the proper method for rinsing and drying your hands after washing, use of hand sanitizers when a place for hand washing is not readily available, the do's and don'ts of hand washing, and finally, in what situations should you wash your hands? Let's get started.
Hand washing is not just a matter of swishing your hands around with a little soap and then a brief rinse with water. As a healthcare EVS worker, you need to thoroughly scrub your hands. What follows is the step-by-step process for proper healthcare hand washing. Step 1. If you are wearing long sleeves, roll or push your sleeves up past your elbows. Your shirt sleeves, if they get a little wet, will just recontaminate your freshly cleaned hands, so get them well out of the way. Step 2. Turn the water on and allow it to get very hot. Not so hot that it gets to the point of burning your skin, but make it as hot as you can safely touch the water. Remember, hot water is much more effective in getting your hands clean. While you are waiting for the water to warm up, make sure that you have a box of gloves nearby and ready so that you can dispense and put on fresh, clean gloves immediately after you have finished your hand washing.
Dispense soap from the wall-mounted soap dispenser above the sink. You should dispense enough to make a dollop in the center of the palm of your hands, about the size of a quarter. Never use bar soap, because it is loaded with the germs and microorganisms of whoever used it before you. In fact, there should never be bar soap present at any sink in Stroger Hospital, unless you are in a patient room bathroom and the patient specifically has requested the use of their own personal bar of soap. If you find bar soap anywhere in the hospital, dispose of it immediately before washing your hands. Step 4. Briefly immerse your hands in the running stream of hot water coming from the faucet, just enough to get your hands wet, but not so much that you rinse away your dollop of soap. Never fill up the sink or any other sort of bowl, basin, or bucket and use that to wash your hands in. Use only clean, hot, running water from the faucet.
Step 5. Face your palms together and rub your hands together vigorously to work the soap up into a foamy lather. Step 6. Work the soapy lather onto the back of your hands and scrub vigorously there also. You should even bring the soap lather up a bit onto both sides of your wrists, about 1/4 of the way up your forearm, to make sure you are cleaning thoroughly.
With one hand, use your fingertips to scrub the palm of the other. Then switch hands and repeat. Scrub thoroughly. Interlock your fingers together, one hand with the other, and scrub between your fingers. Don't skimp on these steps because a lot of dirt and microorganisms gather and lodge between the fingers.
Step 9. Clean the tops of your fingernails and your cuticles. Cuticles are the area where your fingernails grow out of the skin of your finger. This area of your hand can harbor dirt and germs and needs a good scrubbing. Step 10. Clean under your fingernail tips. This is another area where dirt and germs can harbor. If you see visible dirt under your fingernail tips, keep scrubbing until it is all gone.
Step 11. To do it right, each time you wash your hands, the total amount of time you spend washing should be no less than 40 seconds.
Step 12. Thoroughly rinse your hands. Make sure you rinse all of the soap lather off. Do not stop rinsing until all of the soap is gone. Step 13. Thoroughly dry your hands using clean paper towels from the dispenser adjacent to the sink. Dry immediately. Do not leave your hands wet, even for a few seconds, because wet hands attract germs. Do not use a wiper cloth or towel to dry your hands, and never dry your hands on your shirt, pants, or any other article of clothing. Drying your hands in these prohibited ways just recontaminates them and negates all of the effort you put into washing.
Step 14. Take the paper towel you have used to dry your hands and use it to grasp the faucet handles and turn the water off. Do not turn off the water with your bare hands, because this will recontaminate your freshly cleaned hands. Step 15. Put on new, fresh, clean gloves immediately before touching anything else. You are now ready to resume working.
Hand sanitizer is a substitute for hand washing only when you are faced with a situation where you cannot wash your hands. Remember, it is always better to wash your hands with soap and water, and you should always wash instead of just using a hand sanitizer. For proper use of a hand sanitizer, follow these steps. Dispense enough hand sanitizer to wet your hands for 15 to 20 seconds. Rub the hand sanitizer into your palms vigorously. Scrub the backs of your hands. Scrub between your fingers, interlocking them. Scrub your cuticles and under your fingernails. Let your hands air dry.
When should you wash your hands? And how often should an EVS worker wash during a typical work shift? The answer is more a matter of washing each and every time you do certain things that can contaminate and dirty your hands. Generally, as an EVS worker, you should be prepared to wash your hands very frequently during the course of your work shift. It is not unusual for you to have to wash your hands 12 or more times in an 8-hour work shift. Here are some guidelines of when you should wash your hands. After completing the cleaning of one patient room, one procedure room, or one area of Stroger Hospital, and before beginning another. Remember, you want to minimize cross-contamination by not bringing the germs from one area to another on your hands. After cleaning a bathroom, after your own personal use of the bathroom, before and after you have a meal, after shaking hands with someone. In fact, while you are working at Stroger Hospital, it is better to never shake hands with someone. At most, if you want to touch as part of your greeting, do a fist bump, because it's much more sanitary. Always remember to wash your hands after coughing or sneezing, after handling garbage or waste receptacles. Finally, remember to use your protective gloves and to change them often. However, gloves are not a substitute for hand washing. Each time you change gloves, before putting on new gloves, you must wash your hands.
Thank you for attending Stroger Hospital's Video Training Module number 3, Hand Washing and Hand Hygiene.